Making sure your family is getting the best care when seeing a doctor is always a top priority. And joining us today is Dr. Perrone, a pediatric surgeon at University of Michigan Health CS Mott Children's Hospital and Health at Sparrow Children's Center. First of all, Michigan Medicine and Sparrow Health Systems have a special collaboration that people might not know about. Can you tell us more about that?
Absolutely, thank you. So Sparrow Hospital and CS Mott Children's Hospital have a formal partnership that happened about a year or two ago that is dedicated to providing the best care for children in the mid-Michigan area. We provide physicians who come to Lansing every day from Ann Arbor and provide the best of care that we can locally, and then use the CS Mott Children's Hospital in Ann Arbor only when we need to if the care requires that.
So what does this partnership mean for children in our area, Dr. Perrone?
It means that they can hopefully stay closer to home. If they're diagnosed with something that requires, continued medical care, it's really hard on families to have to drive 45 minutes to an hour every day to take care of their child and, take care of anything else that's going on. So if we can, we try to keep them at Sparrow Hospital so they can get that best care, but close to home.
Yeah, when a child is sick, of course, parents or any caregivers don't want to have that added stress of trying to get back and forth to the hospital or the doctor. So staying close to home is extremely important. And your teams offer a wide range of pediatric services. Can you tell us more about those services? Absolutely.
So I'm a pediatric surgeon, and we offer 24/7 pediatric surgical care at Sparrow Hospital. Now, that means that one of our surgeons is coming from Ann Arbor every day. And we, can do a very wide range of cases, from appendicitis to hernias to, almost anything that your child may have. We also, from the University of Michigan, have multiple other subspecialty cares. We have pediatric hematology oncology, we have endocrinology, gastroenterology, cardiology, nephrology, and ophthalmology. And this is in addition to the pediatric general inpatient care, the level 3 regional neonatal intensive care unit, or NICU, and the pediatric intensive care unit, or the PICU.
I'm glad you had the list, because I know that there are a lot of services that you guys provide. So if people are watching and they're thinking that they would, maybe have a child that fits in one of those categories, or they're trying to figure out how that they want to proceed with care, where can people find out more?
You can go online on the Sparrow website. We'll explain all of the subspecialty care that we have. You can also, I always tell people, if there's ever in doubt, if your child is sick, because usually, these things come up quickly, come to the emergency department at Sparrow. We have, like I said, most things that we can treat at Sparrow. And if we can't, then we can transfer to Mott Children's Hospital. We can take care of any urgent needs, and then we can transfer back to Sparrow and try to do the long-term care back at Sparrow.
All right, well, Doctor, we appreciate the information today and for chatting with us here on Studio 10. And stick around, we've got more fun coming up on Studio 10.